I just let her, like it says, and I'm just clicking it. Okay, cool.
Hello, hello. Hi, Kira.
I muted Taylor because she was getting.
Hi, Sandy. Am I saying your name right?
It was, and so I muted.
Yes, that's good.
I forced muted.
Awesome. Welcome. Hi, May.
Hello.
Hi. We're gonna give a couple more minutes for some people to join.
How's everybody's day been? Like soaking in the last bit of the sunshine?
It's been all right.
I'm reapplying my sunscreen multiple times.
I know.
I think I saw in the forecast rain's coming next week.
Sadly, but we do live in Oregon.
I know the Portlander for me is like, I'm ready for it.
Yeah. I'm ready to stay, eat some soup, binge a show.
Kira, thanks for having your camera on.
Yes. I love it. Let's just wait 2 more minutes for any last interesters.
Well, if you want to drop in the chat, I'm curious to know as we're getting prepared to launch the ship, if you will, what are some of your questions that you have? Or if you want to come off mute and share them, that would be great. Tracy's gonna do a welcome, introductions, and then set some ground rules for the session. So
What happened?
the computer gremlins decided to.
Oh,
Interesting.
it's working now.
All right, thanks, Kira.
Awesome. Yes, we'll need to share about that.
I am just starting to learn about PDGF. I've been around the block a few times with collagen boosters,
Yeah.
and so I'm hearing more and more in Tracy's recent education. Like,
the computer
I'm all about it.
Yes. We'll share all the great details about it once we get into one of the slides. But for now, what a great time to be alive to have PDGF as one of our tools. Oh, that's awesome, Sandy.
All right. Have we recorded this? Have we started the recording?
Mm-hmm. Yes.
All right, fantastic. Thanks, Jen. For the sake of time, to reward everybody that's here on time,
Yes.
I would say let's crack into it. You ready?
Yeah. Thank you everyone for coming. I know everyone has a busy schedule and is working, so thank you so much for your time. Just want to start out, if you don't know me already, my name is Tracy. I'm the lead aesthetic nurse injector here at Refreshed MD. I've been at Refreshed for almost 2 years now and an aesthetic nurse injector for 4. I've been so privileged to be able to join aesthetics straight out of nursing school, and it's a blessing every day to do what I love to do. Fun facts about me: I love to travel, I love to eat. So you can find me on my days off finding a new restaurant to eat, cooking. I do love to cook and bake as well. And I am a lifetime learner. I love to share my wealth of knowledge. So hopefully you guys will learn something from me here today. Alrighty, so just getting started and some ground rules. You guys are doing a perfect job at putting all of your questions in the chat below. Kat is keeping track for me and will interrupt me when it's appropriate to answer your questions for you, but some of these questions will be answered in the slides that I have. So as far as how it's going to look, we're just going to dive right into the information about all the products of PDGF and collagen stimulators. And then we'll have a period where we're going to do a live demo with Kat here.
But no needles. We're just going to mark
Yes.
the sister up. So
what it looks like in a consultation, and what happens during the aging process, and how we can utilize all these tools to help us age more gracefully. And then at the very end, we will have plenty of time to answer any more dying questions that you may have at the very end, okay? All right, we're just gonna dive straight into it. So I am going to start by sharing my screen here.
And this is the first time that we've done a webinar. So I think we're gonna send a little bit of a pulse check of how did this go for you. So if you could please complete the survey and let us know how we did, what worked, what didn't work, what could be better for the next time. Any topics you'd like for us to go after, we would love to hear that feedback.
All right, can everybody see my slide? Great.
Thanks, May. And I'm an emoji person. So if you guys want to leverage the tools and do the hand claps or hearts as we go through of anything that is like, whoa, I didn't know that, or wow, I really love that. Like, to keep you guys engaged, we'd love to see that come across the screen if you're able to engage with us that way.
Awesome. Alrighty, so diving straight into it, advanced growth factors. This is a platelet-derived growth factor, beta, and what you're going to continuously see more on social media and other platforms. So PDGF-BP. This is a very innovative treatment that has been introduced into aesthetics this year. It was used in medicine before for the past 15 years and treated over 15 million patients, but this year it has been introduced into aesthetics. So we're very, very excited to showcase the amazing potential of this treatment and what it can do. So what it is that it's a synthetic growth factor, and it's grown in a lab to replicate human growth factors. Now, this is not a byproduct of human or animal. What it is that they take a human DNA and they see what recipe it takes to make up this growth factor, and they do the same thing synthetically. So it still is the same as our own human growth factor, just not from a human or an animal. Great things about how it is, because it is lab grown, we take away all the different factors as to why our own growth factors are not as potent or as healthy. So factors such as our age can be a factor as to our plasma can't be as healthy with growth factors, lifestyle, and just the way how healthy it is. So with this, we don't have to worry about any of that. And I jumped a little forward here, but with growth factors, what they can do is that they help to generate new blood vessels, tissue repair, and produce collagen, which is something that we do need as we age. So comparison wise with PRF, which some of you have already heard or have had yourself, it is our own platelet rich fibrin. So many P's. So with platelet rich fibrin, it is what we can find in our own plasma. But with PDGF, we can find it 300 times stronger. So in one treatment, you can get up to 300,000 growth factors. And like I said, with the great benefits of it, it's stable, it's consistent, it's efficient, and you can get fast results. With our PRF, you do your one session and then you do another session in 4 weeks, and we recommend 3 to get best results. So it's a lot longer of a timeline. As with PDGF, we can condense it to about 5 to 6 weeks to start to see your results. And what can PDGF be used for? So the whole hype that we have been seeing all around, and what we are so excited to provide, is the under eye rejuvenation. The under eye area is such a delicate area that filler sometimes is not the best option. PRF there may be factors as to why it's still not the best option. Then we have Easy Gel, but now we have something that has shown immense results in even just one. Sometimes you need to require 2 or 3, but for the majority, we're seeing amazing results with just one treatment. So under eye rejuvenation, we've been using it for hair restoration as well, and we've seen amazing results there. I've personally used it for microneedling, and I do have to say it's something that I haven't experienced this type of result before. I healed so much quicker. My skin texture has improved more than one session of any other microneedling has done for me, and the skin glow and the skin repair that I notice afterwards, and it lingers for a really long time. Another thing too that we are using it for, I mentioned, let's see, under eye rejuvenation, hair restoration, microneedling, and there are combination treatments that we can use. I can get into it a little bit later with PDGF and dilute radiance for neck rejuvenation. Another great thing that PDGF can be used for is post-laser treatments that can be used topically to help you heal a lot faster. Okay. Just a little plug in there. We do have our September special with the under eye rejuvenation with PDGF this month. So as a non-member, we are offering it for $650 a session when typically it is $750. And then for members, we want to thank you for being a member. It is $600 for members. So I did see a question come from Kira. So let's see.
For under eye, what types of results are you seeing? Is it less hollowing? Is it less dark?
Yes.
Like superficially, what are you seeing?
Yes, so we are seeing immense results with volume. Anyone who has hollows, it has done a great job at producing volume and tissue to the area. And when you have healthier skin and more tissue in the under eye area, that reduces the appearance of the pigmentation under the eyes. And we've also seen results with any patients that have had under eye bags, herniated fat pads or under eye bags. There have been results with those patients as well. So this treatment can be for almost anyone.
Oh,
Yes.
Awesome.
Which we haven't had a product like that, I think, ever.
Yeah.
As far as being able to offer it to almost everyone.
Amazing. Kira, did that answer your question? If you want to give us an emoji and let us know. Awesome. Yay. Thank you.
Awesome. Any further questions with PDGF before I move on?
Is there anybody who's not an ideal candidate for this?
No. And I forgot to mention, but I went to a master training in Las Vegas this past weekend where I am one of 48 injectors in the nation that are masters of injecting PDGF. So that is something that's really exciting.
So proud of you. Awesome. Well, we had another question come through. How does it help with premature under eye lines?
Yes, so we have lines under our eyes due to some dehydration and also volume loss in the under eye area. So again, with the tissue regeneration and building volume in the area, that will address the fine lines and wrinkles as well.
Awesome. Sensitivity. Did that answer your question? Yeah, for sure. Okay, thank you.
Awesome. All right, are we ready to move on?
Yes. Get it, girl.
Yeah, all right.
All right, so biostimulators. I think the word biostimulator or collagen stimulator has been thrown around, and what does that mean and how does that differentiate from growth factors? So with biostimulators, these are injectables that we're able to inject to help stimulate our body to produce collagen. With growth factors, that's something that are helping with our fibroblasts, to the kind of a precursor for our fibroblasts to create collagen. Biostimulators are something that helps feed the fibroblasts to then create collagen. So a little bit different there. And then biostimulators are injected to target these fibroblast cells to help create collagen. With collagen or biostimulators, they do take time to see results. This is something that we like to say is our undetectable injectable. Not something that's instant gratification as like hyaluronic acid fillers that we see in other treatments. These treatments, depending on what your goals are, they do require more than one session to reach your goals. And it does take time to see the best results. And these results are amazing when you compare them side to side. They can be slow, but can be amazing results in the span of 6 months to up to a year. Lots of, let's say your family or your friends, when they see you, they can't quite pinpoint what you did, but you do look really amazing, okay? All right, so what are the types of biostimulators that we carry? The first one we carry is Sculptra. Sculptra is made up of polylactic acid, and polylactic acid, fun fact, it's what surgical sutures are made up of, but with Sculptra, it's kind of shredded into these tiny little threads where we can reconstitute and make it an injectable. And with this being an injectable, we are able to target certain areas of the face, of the neck, and other off-label areas. I won't discuss those. But common areas, face, hands are also an area too. Sorry, I misspoke, not neck. Neck would be dilute radius. So with Sculptra, areas that it's great for are in your temples, in your lateral cheeks here. It can be in your piriform here or nasolabial folds. These are the smile lines area that everyone complains about. They can be put in your chin, your pre-jowl, your jawline right here. Left here. So it can be placed in many different areas on the face to help replenish volume that we've lost. Any questions on Sculptra? I did miss a point. So with Sculptra, it is allowing for a controlled inflammatory response. And with that controlled inflammatory response allows for the fibroblasts to be stimulated to create collagen. Any questions there?
Just a quick pulse check. How's pace, like the speed of information that we're sharing? How's the tempo? Okay, getting some thumbs up. Thank you for the feedback.
All right. Sorry, I missed Kira's question.
So years ago, I had Sculptra. They mentioned you need 1 vial per decade of life. Is that still true?
That can still be true. It is a good guide, but depending on what your goals are and have we gotten you to your goals, that's kind of a different topic in your consultation. So let's say you're 35 years old and we use 3 vials and we reassess in about a year, 18 months. Are we at the results that we like? No, then maybe let's add in another vial or 2, or that was the treatment that did it for you and you're happy with your results. So all of these are just guides as far as like a decade of age per vial, but it shouldn't dictate what your treatment should look like. It should be up to you and how you prefer your results.
Yeah, awesome.
Yeah, I have another question. Can this be used on your knees?
What a question.
It can be, but we'll share why dilute or hyperdilute radius would be the better option for non-face areas as far as collagen stimulation for the body. So great question.
I know.
And I think we're going into
Yes.
dilute radius. Yeah.
Yes. So with radius is made up of calcium hydroxyl apatite, and this is something that can be found in our teeth and our bones. With this filler, when we talk about radius, it is a filler, but because of the way that it's made, we are able to manipulate it to become either a filler, a semi-filler, or just strictly a collagen stimulator. And with this one, what the calcium is doing, it's encapsulating our fibroblasts, the term that I used before, the cell that helps us produce collagen. It helps encapsulates it and heal the fibroblasts and feed the fibroblasts so that we're able to produce collagen and elastin. So with this biostimulator, even as a filler, there are some biostimulating properties to it, but we can manipulate it so that we can get biostimulating properties in the face and not so much volume if that's not what you're looking for. So common areas again are in your temples, in your mid-face, lateral cheek. It can be put in the nasolabial folds here, jawline, in the pre-jowl, in the chin. And then like I mentioned, because we're able to manipulate it so that sometimes when something is too strong, it can cause balls of collagen to grow, and in delicate areas like our neck or our hands or our elbows or knees, we don't want formation of little balls of collagen there. So we're able to manipulate it to be not as strong, hence why I called hyperdilute, to be able to allow for collagen to grow, but seamlessly.
Awesome. So Kira's curious to know what causes you to choose between Sculptra and hyperdilute radius for a patient, thinking just the face.
Yes, great question, Kira. So as far as goals, with radius, I am able, in the face-wise, manipulate it so that patients are able to choose if they want volume as well. Because with some patients in the past with strictly Sculptra, they aren't able to get instant volume, and it's something that they have to wait 6 months up to a year to really see the results. With the dilute radius, I'm able to manipulate it so that I'm able to give you your instant gratification of volume, but also get biostimulation as well. So this, as far as which one to pick for a patient, is dependent on their goals. If it's something where it's just preventative, I don't want someone to know I've gotten it, I can pick Sculptra. If it's something where I do want a little volume, I don't want hyaluronic acid, and I also want some biostimulation, then I can pick radius for them. So depending on what your goals are, maybe too, if someone, let's say, has an autoimmune disease, not that you can't get Sculptra, but it is out of the two options, not as stressful to use radius because it's not going through an inflammatory response. With autoimmune diseases, it's your body attacking its own self. So something that's one less stressor for you.
Awesome.
Yeah.
Kira, did that kind of help you? Perfect. Answer your question.
Awesome.
And speaking of someone, and we'll probably get to this later, I'm a junkie. Like I'm north of 50. And I'm all about, like, I want to look like me.
She doesn't look like it.
Thanks, you. I want to look like me, but I just want to look refreshed. And I've done both treatments. So I think we'll talk about that later, and I'm happy to answer your questions. So you've got a real life person here who's experienced both and seen results from both.
Yeah. I think I put in a little fun fact, common area or uncommonly treated areas that are areas that dilute radius or hyperdilute radius can be put in would be stomach for like stretch marks or stretch tissue for some postpartum moms, knees, buttocks, if you've heard of a liquid BBL, that is something that is used for a liquid BBL.
We've got a question of what's a good age to start?
Yes, so backtracking a little bit with collagen loss. So by the time we hit our mid-20s, the rate that we're producing collagen is actually a little less than the rate that we're breaking down collagen. So great to even speak of the idea or think of the idea of collagen stimulators at around your mid-20s, and then maybe do one session a year or session year and a half, and then build as you go. But in your mid-20s is actually a good time to have a discussion with biostimulators.
Because that's kind of your peak, right? And then is it you lose roughly a percent of your collagen per year?
Yep.
So
yeah. So did I answer your question?
Cindy, how'd we do? Did that answer your question? Perfect. Thank you.
Awesome. Yay.
All right.
Great.
What else we got?
Yeah, well, that was all the products that we have. Oh, I totally forgot to show. I have the products here with me. So
But-
going back, this is what PDGF comes in, and so it's a little injectable here, and it's liquid in here, and we mix it in with some saline to help make it the right strength of a dose for you, and then it's able to be injected under the eye or able to be put as hair restoration on the hair. And then for microneedling, it's a little different. It can be mixed in with a little bit of hyaluronic acid as a glide on the skin. And then this is what Sculptra comes in. It comes in a vial like this, and like I mentioned, it's similar to what surgical sutures are made up of, and it comes in a powder form that we reconstitute to become a liquid that we're able to inject. And then we have radiance. Radiance comes at the same similar box as the one on the screen. It comes in a syringe as an injectable or a filler that I'm able to manipulate with saline as well to be able to be injected as a pipe stimulator.
It's like an ASMR, like watching you mix
like
it.
mix it back and forth. Yeah, it's really fun.
Well, and tell me if I'm understanding this correctly, because I'm just learning about PDGF a little bit more. So if I understand it correctly, how you've explained it, PDGF is more like when it goes into your skin, it's like come here, get healthy.
Yes.
Whereas the collagen boosters are like,
Spreading
I'm going to send you out to repair and boost.
Yeah, so with PDGF, the growth factors, our cells are attracted to the growth factors. So the cells are actually going to come to the growth factors where we place it. That's correct. And then with the biostimulators, those are what we disperse out to help with the cells in the area and feed them.
Awesome. So it's either like, come here, or hey,
Yes.
go do
Go
good
out
work.
and do it. Yes.
Okay.
Yes.
Perfect.
Yeah.
Thank you very much.
Awesome. So a little intermission here as we kind of transition over to do our demo with Kat.
Sure. And again, if you're worried that it's needles, it's not needles. She's just going to mark me up how she would if you were sitting in the chair with her. Any questions? If you guys want to come off mute, questions? How's this feeling? Are you getting what you expected to get out of this webinar?
The pulse check.
Yeah. All right. So some hearts, some claps. Perfect. Give the people what they want is what I say. So I'm glad you're getting what you need.
Hey.
Awesome. All right. Where do you want me?
In the chair, please. Okay. Let's see. So I'm gonna stop screen sharing here. Awesome. And then if I can move this a little closer. There we go.
Oh, that's great.
Yeah.
I was gonna go in, but you would see me.
Yeah.
All right, Kat.
I almost did. Just went ahead.
I mean,
Right.
if
So
you
we're
fall,
gonna treat
your
this
hair
as
is
a
amazing.
consultation, what I would do in a consultation if we're interested in any of these treatments. Alrighty, Kat, we've been in this chair before.
Many times.
Alrighty, so in the past, let's go back to before we've done our biostimulators. What are some concerns that you had that you brought up to me and that we were hoping to address?
Well, as a time fighter, I don't want to see time march across my face. So for me, I'm somebody who sits at my desk. I'm on Zoom, Google Meet type situations. I'm leaning forward, and for me, it was the jowling where I was like, oh, heck no, I don't want that. So it was some of the jowling. It's this most recently, we talked about the nasal labial folds, and I think just looking hollow.
Yeah.
I don't want to look like Captain Graceful, and just look like I felt lost, especially when, it felt very rapid for me, what I saw in the mirror after 45.
Gotcha. Yeah. So thank you for sharing.
Yeah.
that. So let's address some things as we age. What are things that are happening for you to experience some of this? So a couple things that are happening here. We're talking about losing collagen, like we mentioned, with as we age, after mid-20s where we peak, we lose 1% of collagen a year. So now we're not having as healthy, bouncy of skin. Okay, then we're now talking about our bone structure. Our bone structure gets more resorbed, so it gets less and less as we age. And then we have shifting in fat pads. When we're young, our fat pad sits nice and high. And as we age with gravity and all the other factors I just listed, it loses its structure and it drops. And so, move your hair back here. So as we age, turning here, let's say, for example, her mid face was held nice and high up here. So as we age, it drops. And when it drops, then now she's noticing some skin right here that is loose and she doesn't have as much structure there. And similarly to out in our lateral face out here, as we age, we lose some of that volume out there as well as structure with all the factors that I mentioned. And so you're not only dropping this way, you're also dropping it forward. And a lot of my more mature patients come in complaining about what can we do about this? What can we do about this? And so everything's getting dropped this way, hence why having more prominent nasal labial folds here. So what are ways we can combat that? We can pick our biostimulators before we pick up the hyaluronic acids, which give you instant results, but in the long run, it's not going to give you any benefits of feeding your skin and increasing your skin health as well as volume.
So for me, I always like to think of filler being like you're renting and your biostimulator being like owning, right?
Yeah, that's a great analogy. So let's say the concerns that Kat had, what did we do with the biostimulator? So something that I don't even think you mentioned to me was some hollowing in your temples here that I brought up to Kat and we addressed. And so we added in some volume in her temples here, because as we age, what happens here too is that we're losing that fat pad, the bone's getting more hollow, and so your brow actually starts dropping in, and a lot of patients will notice some hooding in their lids, and so it's some lack of support there. So to bring that lift back up non-surgically, you add in some biostimulator here for your body to build that collagen and build that structure and volume to lift it back up. Okay, and then kind of moving down the face, laterally out here, we also added in some biostimulator here too to help what Dr. Taylor likes to call the scaffolding in the skin to help hold the skin back up and replenish that volume that we've lost. We also like to add some in the jawline as well, because that is also another place to hold our volume back up and help tack the skin back so that we don't notice more of the heaviness down in the pre-jowl area here.
Oh, you say that so kindly. Because it dropped like it was hot.
Well, not anymore. And while all of this is happening too, it's also helping areas that we haven't even addressed yet, which is in the nasal labial folds right here, and some in the kind of chin shadows here as well, when we have some volume here. Areas that we can also target after we've addressed all this and it's still prominent is in the nasal labial folds here, in the pre-jaw of the chin here, all along here. We can do some in the chin if that was an area of concern of ours.
Can you explain why you're marking in lines?
Yeah, so the technique that I use is a cannula, and what a cannula is a blunt rod, and the blunt rod it's not piercing through the skin, it's asking your skin for permission. And so I'm able to do a little porthole here, and I'm able to thread the cannula under her skin into all these areas here, where in the past we've had to use a needle to administer the product, and it's just a lot more invasive and a lot more downtime. With this one, I would say you are a little bit sore afterwards, but it does go away pretty quickly. Would you say, Kat?
Yeah, and can you all see like where she's marked me up? Is this,
IA.
can you give me an emoji and let me know, like,
Okay.
picking up what we're putting down? Yeah, okay,
Uh-huh.
kind of.
Maybe have you scooch a little
Yes.
closer. Yeah, angle out.
So
Have you turn this way. So
instead of a lot of needle pokes in,
like perpendicular, instead of a lot of needle pokes, I'm going in this way to put the product where I want it to be. I'm able to use a cannula. Let's say insert the cannula here. I'm able to thread it through her skin all the way through this way, so that I'm able to administer the product without causing that much damage to the skin. Yay!
and it's nice because for me, using a cannula dramatically reduces the bruising, which, like, at the end of the day, that's what matters most to me post treatment.
Yes.
Because I am on camera quite often. So
Yeah. So if it's something where you work in person, or you're a speaker, or anything where you do have to be out and about and you don't want to be bruised, this is a great alternative to needle work to be able to give you the product, but also be really careful with bruising.
yeah.
Yay.
Awesome. And Tracy's so great. The team as a whole are really great with like numbing and making sure that you're comfortable. Like oftentimes Jen or Jess will come in and like pat my head or do lots of different techniques to disrupt my focus on what's actually happening to help me feel more comfortable. And of course, like the widgets, like the squeeze balls and the little tool, the vibrating tool, like all of that is so helpful. And so it's uncomfortable, but it's not intolerable. Right?
Yes, it's not unbearable. It is uncomfortable. Beauty is pain, remember? But it can be tolerable.
Yeah.
All right. I think that's
What else?
demonstration. Oh, we've done your neck.
Oh yes, we did my neck.
Well, and so with the neck, sometimes we call them the
Trying
tech
to
neck
look.
lines, or
She's
and
like,
those are so
I don't look at
soft
it.
now.
Thanks to you.
They're those horizontal lines here that we'll have on our neck, and that's through time, the way we sleep, the way we hold our neck like this.
Doom scrolling in bed.
Yes, me too. And so the hyperdilute radius can be placed into the neck to help restore the skin.
25
skin
to
health.
23.
And with that one, I also again use the cannula, and I'll do the
Roughly
parts
the
here,
size of a blade of
and I'll
grass.
thread it through all throughout here. And we've done this on Pat before. And it can also be in the submental under the chin area right here. I have some patients that are complaining of loose skin down there, and so it's a great treatment to do underneath the chin to
I think I
help
manage you now. Let me see.
strengthen
Yeah, I
up
might
the
not.
skin underneath the chin.
I was honestly nervous because you think about the skin on your neck and you're like how thin it is. And it was like bam bam. It did not take you much time to get in and do what you needed to do and be done with the treatment. I was so impressed.
Yeah, and it's something that we've done really quickly and easily
Sorry,
too.
girl.
Yeah.
I don't manage
Touching
you.
a little bit of a base on the PDGF, I also use cannula as well to inject, and I do my port here, and I'll thread it through very, very slowly. The key with PDGF is we want to cause as minimal trauma to the area as possible to help reduce the swelling and the redness afterwards. And with PDGF, because it's so potent that it's allowing for a process called angiogenesis, which is a formation of new blood vessels where it can bring nutrients and oxygen to the area to allow for the healing and the regeneration of tissue. And so it is expected and normal to experience up to 2 weeks of the redness and the swelling, and not severe swelling. It's just almost kind of like puffy, like if you've ever cried like before you go to bed and you wake up and it's a little puffy under your eyes or some allergies, that's the puffiness we're talking about.
So advice on like pre-treatment care and post-treatment care
Yeah.
for
So-
really great results.
Yes. So pre-treatment care, and I just care about your well-being here. Stay really hydrated, eat before you come, avoid any alcohol or blood thinners so that we can really reduce the risk of bruising and swelling so that we can get quicker and better results without that much bruising and swelling. And then aftercare wise, let's say with PDGF, light massaging under the eye is great. And then with both the Sculptra and the dilute radiance, it's great to do the 5-5-5 rule. What that means is 5 minutes, 5 times a day for 5 days. We're going to be massaging our skin with some firm pressure to really help disperse all the product into the tissue and allow for that regeneration.
Love it. Well, and I like to use the arnica cream when I do my 5-5-5 to help with any bruising that I have and help with any puffiness.
Yeah.
Pro tip.
Yes.
Anyway.
Alrighty, so I know we're about to be done with time here, so let's go back and see some questions that you guys had. Let's see here. What size gauge of cannula? So I am using, this might not mean something to some of you, but I'm using a 25 gauge cannula for the face and a 30 gauge cannula for the under eye. So pretty small and tolerable. Yeah.
And then I see the question from Kira around understanding biostimulator to help pull up any jowling.
Yes, because like I mentioned before, the jowling occurs because we're losing structure in the lateral face here, and sometimes for some patients in the lateral and medial cheek here too. When we're able to build that structure back, it's actually going to attack the skin back and take away that jowl right here. And any finishing touches with neurotoxin in the area is great too.
Yeah, that was my biggest concern, Kara, was the jowling bit, because I just did not like what I saw in the mirror anymore. So I took care of that.
Yes. Let's see here.
All right, looks like Jen was able to capture some of those questions as well.
Yes, fish oil can cause for blood thinning effect. So if you can pause your fish oil, that would be great too. And just put filler for it.
Oh, for this, yeah.
Yes, it will be. Alrighty, any last minute questions before we log off?
All right. Thank you for being here.
Thank you so much. It means a lot for us, for you to join us, and to hopefully you guys learned something new from this webinar today, and hopefully we get to do many more webinars. Xsurf, I'm unsure what Xsurf is.
Is that a brand, Cindy? And you are free to come off mute if you want. Ah, okay.
Treatment. I am unsure of what Xsurf is. If it is FDA approved in the US, then it would be a treatment that we know of, but maybe it might not be an FDA approved treatment in the US. I will do some research on that. All right. Gotcha. I will do some research on it. Thank you, Sandy.
Well, as a lifetime learner, I'm sure you're going to be all about that tonight.
Yes, I'm curious what it is.
Awesome. And then we're going to send out a link for you guys to take a survey. Just let us know how this worked for you, what we could improve, what you'd like to see different, and any future topics.
Yeah. Yes, please.
All right.
Love to share more. Awesome.
Thank you so much,
Thank
Tracy.
you. Thank you, May. Thank you, Sandy. Thank you, Kira.
Bye.
Bye.